Risk: excess belly fat and increased belly pressure. Hernia: have given birth to a large baby. Older adults whose muscle decreases as they age. Bloating due to excess gas. Multiple pregnancies like twins or triplets, especially with little time between them. Surgery on belly: earlier, their muscles may be weak due to cut. Diagnosis: diastasis recti normally involves a physical examination by a healthcare professional, such as a doctor or physical therapist. The healthcare provider will assess the separation of the abdominal muscles and may use different methods to determine the extent of diastasis recti. Here are some common diagnostic techniques as well as few self-assessment methods. Self-assessment or finger test: lie on back with knees bent. Place fingers, mainly the index and middle fingers, horizontally just above belly button. Lift head and shoulders off the floor, as if doing a mini crunch. Feel for any gap or separation between the muscles. A gap of more than 2 finger widths may indicate diastasis recti. Check for weakness. Pay attention to any difficulty in performing activities that engage the core muscles, such as getting out of bed, lifting, or bending over. Palpation involves gentle pressing on different areas of the abdominal muscles, so to identify any separation or gap between the left and right. Sides of the rectus abdominis. Visual examination. During this examination, abdominal area is observed through specific movements like lying down, lifting the head and shoulders, etc. It allows to observe any bulging or separation of the abdominal muscles. Functional assessments evaluate core strength and stability during various movements. It can help to determine how diastasis recti may be impacting daily activities. To be continued. Thank you for watching my video. For more videos, kindly like, share and subscribe.